Hey Adrian, how's it going? So, I'm going to do things a little out of order from what's in the chat just for, well, because I have this video up now. But apart from to say, this issue, yeah, we need to keep an eye on this. I think I was tempted to just immediately reduce some of the stuff from your program, but I kind of also want to leave this a bit up to you and let you use your judgment. So if things feel, I mean, you're mentioning that it's a bit of discomfort. I don't know what that means. So if this is like pain, then I need you to, yeah, call an audible yourself and decide what training loads to use, or drop some sets or reps from sets, and let me know what you think is useful. And if we're getting into this territory, then if you have any impression of like whether it's load related or training frequency related, or anything like that. I know there's a bit of a question mark about the organization of the week. I don't think that will have an effect on this specifically. I think this is more of like an overall, either some mobility problem, that's most likely what it is, i.e. some mobility problem that's through your hips that's causing your lower back to move more than we'd like it to, and therefore it's getting a bit unhappy. I think basically it's likely to be that, or that we're just basically introducing things a bit too quickly, in terms of this like 4 day a week format. But yeah, let's see how it goes a little bit is my advice. The caveat there being, don't actually hurt yourself, and do your best to kind of think about that as you're warming up. But yeah, just to go from that to the chops. So this is better, but just compare the position that you're in here compared to what Connor's doing. So let's get you to the same side. Right, so if you look at what he's doing here, he's a lot more upright than you are. So, he's a bit more like this. And what he's really doing is punching down in these directions, right, with his arms. And you kind of like getting that a little bit on this, assuming your camera's not rotated, but on this left arm. But you're a lot more like across your body than he is. So the same angle, just use a different color, would be more like this, which is probably not achieving the same things, right? So Connor's able to push his shoulder blades a lot more forwards and really protract his shoulders more than you're kind of getting here. And the effect of that is that through these sort of posterior bits of his rib cage around here, there'll be lots of expansion, right? That's what we're looking for. And maybe you get a little bit like through here, through this bit of your rib cage, but you're not getting any here. And that's kind of what we're looking to achieve on this drill. So let's just watch what Connor's doing a bit as well. And you'll notice, well, he froze. So what he's doing, does he walk you through this? Let's just watch this together.
Hip width and attach a rope to a high cable machine, and then turn into one side as you exhale and slightly round your back.
So this is the important point I think you're not getting, is that, I mean, you're kind of doing it, but there needs to be this chop, press down as he's doing here, like pressing down in this direction as he exhales, and then exhale before coming back. So you exhale, reach and push. So if you imagine, let me just draw this. We love a awful diagram. So let's say this is your rib cage viewed from the top, and we're going to put your shoulder blades here, right? Ish. If we move your shoulder blade, let's say this is like resting. Let's say and the position that Connor is in here, is a bit more like this, right? So shoulder blades move to the side of the body. When we're in that position, right? So, and we take a breath, we get expansion through here, and a little bit of expansion through here as well. That's what we're trying to do. We're trying to compress laterally with the action that we're doing, i.e. rib cage, sorry, the shoulder blades on more on the side of the rib cage, and we're reaching and protracting. We'll also, there's a little bit of a bias as well, sort of left to right, so he'll get more expansion on his left upper back here than his right upper back. Actually, that's not necessarily true. It might be, well, it could be argued either way. But yeah, so there's a little bit of an asymmetry in what he's doing, but again, that's really useful because it helps us loosen up the rib cage. So that's what you should be thinking about as you're doing these, is this, like, you're not just doing a pullover, which is kind of
shifting into
a little bit of what you're doing at the moment still, is like kind of just a pullover rather than this like lateral chop. Yeah, I hope that makes sense, because this is like quite a high bang for your buck drill to be doing. So I think that the biggest things for you to take away there are just like be a little bit more, or a lot more upright through your torso. And then really punch the arms down and have both arms straight as well. It's a big difference between yours and his execution here. You see that? Both of his arms stay straight. Well, straight. There's a slight bend in the elbow, but it's a fixed bend in the elbow and it's quite small. But yeah, I hope that makes sense. I think this looked better. I had a quick look at this before this drill. Excuse me. Yeah, no, I think this is better. I think I showed you another drill. Yeah, so this is probably too... this might be okay. This might be okay. But this is... I think the easy way... No, in fact, I think this is not ideal. So I think, just looking at the position of your shoulders here, it's way easier for you to get this right, kind of more sat at a desk. So in fact, if you were to kneel down with your knees like here and here, and then put your elbows on the bench, that probably works best. Because then you're able to get your shoulders out of your ears a bit more. Because I want to see this expand, and I think right now most of the stretch will be coming in this line. If that makes sense. So I think just slightly rearrange this. I.e., kind of what I'm really suggesting here is that your arm angle currently there, I want your arm angle to be a bit more, well, that's a bit too much, but like this. So you get reciprocally, if you're punching down this way, you'll get expansion through this upper bit of your back more. Cool. Alright, let's have a look at the squats and see if we can see if there's anything obviously weird. No, it doesn't look crazy. There's a tiny bit of instability, perhaps, in your lower back. So one thing you could just, unironically try to do is just brace a bit harder and see if that helps sensation of discomfort and instability. Yeah, bench looking really good. I think you mentioned that the deadlifts were affected by the the split squats. But those still look kind of fine. That's the big long pause press. Super nice. This is a good angle. Okay. This is really useful to see. It actually looks good, which in a way is a bad thing because I can't give you any. It's not that it's not causing any problems for you, right? So there's nothing here that I can see that is a sign of any issue through the lower back. Knees are being really well behaved. Maybe left knee is less, but I can't see. So okay, just to think about squats. Let's say for next week, try to give me some more angles. Try to capture this left knee behavior, just to double check if anything wacky is happening on that side, and maybe a fully front on or fully back on view, so we can see what's happening on both sides and really see what's happening with your pelvis. So with these like pulsed warm-ups, you are still kind of wedging, right? So you're using more or less just this, like, you're pulling with your back to get the bar off the floor. What I kind of want to see is your back. Maybe I'll send you a video of this, of me doing it. I don't actually have one. I'll try to remember to take one of me doing this on Tuesday. But yeah, I want to see you have this fixed back angle and just kind of press with your knees. So a little bit of like hip extension and then a little bit of knee extension to get you off the ground, and then come back. I don't want to see your back angle change at all. I don't want to see your back do anything. I want your back to just be locked in and static. And similarly on the way down, right, you should be able to just take this entire system and just come down. But you have to kind of like rotate around something. In fact, I have an idea. Bear with me, we're going rogue. Because I think, let me just double check this first, because this, might not be able to find this. Just trying to see if somebody else has an example of this, but I'm not sure if they do. Okay, I'm going to give myself a cut off of like another 10 seconds, 20 seconds. Found it. Okay. Mr. Pickering, let me just bring this one tab. Alright. So, Will is doing this, but as an actual exercise. So I don't want you to do this. I don't think this is super useful to do mega heavy. But look at how Will does this. Right? So it's just all one solid movement. Even he's struggling with this, right? You can see a little bit of like drops the weight quite hard on some of these reps. But yeah, this is kind of the vibe that you need. Just kind of like this leg press off the floor with this not much happening in your upper body. Yeah, that's kind of the vibe that we want with these. I do want to basically kill this wedge that you have off the floor. I know you probably like it, but it really will punish you when you get to a stiff bar. The other way of thinking about it is this currently what happens to your positioning in the bar between the ground and the pause is not what will happen when you're pulling your like RP10 third deadlift, right? It will look a lot more like what Will was doing, ideally anyway. You have this really locked in pattern where you're just driving straight up. Any deviation from that is going to, is not going to work, and you'll be pulled into a weird shape. Okay, how are we doing? Body stuff. All right, so I think where are your hands? So with this one, palms need to be up. I think your feet should be a tiny bit close to your butt as well. And when you're setting this up, prioritize kind of pressing your lower back into the ground first and getting that tiny bit of rotation through your hips, locking that in with your obliques as you exhale. Then, adding a bit of this, holding the roller with your adductors and then the hamstrings. Looks okay apart from that. But yeah, I think just heels a bit closer to your butt to move these step feet things a bit closer to you. So yeah, this is interesting. So this is a fault. What you're kind of doing here, right? I could just draw a line in your spine between this point of contact on the floor and your pelvis, and it's not. These segments here aren't moving at all as you kind of like lift your hips. Whereas what we want really to happen is to leave this bit of your back on the ground and then like gently, like this is an exaggeration, but just segment by segment slightly rotate those bits of your lower back. If you're not doing that, then you're not getting the most out of this drill. Same thing applies to the previous one. This is what I mean by prioritize having your lower back pressed into the ground first and then feel your pelvis tuck gently. This will help your lower back discomfort stuff, almost certainly. There's only tissue in there that needs to relax. Getting this opening of this of these posterior segments and getting some space between those vertebrae will help, sort of like lengthening all of the tissue through there, allowing those bits of muscle to relax. Okay, so this is pressing in here. This looks fine. I think the only thing that is sticking out to me is what's happening. Oh, that's your. I'm guessing it's your little toe. But just make sure that you're. Hopefully you can. I can't draw this with this thingy here. But make sure that you are pressing this part of your foot and this part of your foot. So this inside edge of your heel and big toe knuckle like down to the ground. That's the important piece. Okay, this stuff. Yeah, this looks better. Yeah, this is much better. This is now fine, I think. Okay, so this is going to be... Which one is this? I don't know what you're doing there, sir. I'm guessing I sent you something. This one? I'm guessing it's this one. So, right. The difference with what he's doing there and this is the degree to which you are getting this kind of like arch in your side rib cage. See if we can really pick that out in the video, because maybe that's not super clear.
Further recruit those down to get in a position where we can leverage our downside obliques.
Yeah.
And we can do that in a position that's pretty easy to manage at first. So we want to be 90-degree bend at both our knees and our hips. And then we have this elbow directly underneath our shoulder. Now, it's important here because we're going to leave our hips on the ground that we get a push through that downside forearm, which is going to really crank us up right here. But not so much that we're shorting that top side shoulder in. The shoulder should still stay down, but we should be a little bit of this rainbow shape in this downside.
Yeah, so we need the t-shirt's in the way here. It's a shame that he didn't get his guy to wear something a bit tighter, but there, he will have this like really big arch on the side, basically.
Side abs on that downside. And then what we want to do is reach low relative to the position of our trunk with our palm up. And on the downside arm, we should have our palm up if we can. If we cannot, a nice neutral forearm position would also work. And then we just want to make sure that we're going to exhale nice and soft, getting all that air we can get out. And that will help us further recruit those downside abs. Pause between the exhale and the inhale.
Anyway, you have this video. That's basically what we need. The progression from this is the full. Does he do this? I can't remember if he includes this. No, so he includes this regression, which is maybe something to think about to encourage you to get this position. But yeah, so the progression of this is then raising the hips off the ground as well with this arch in your side abs. But yeah, this is not quite getting the right vibe. It's close. The other bits are right. So hand position looks good. 90 through the hips and knees, but yeah, we need more of this arch through the side abs. Cool. I think that's it. All right, man. Good stuff. Yeah, let me know about the like lower back discomfort pieces, and we'll kind of like see what to do. All right. Cheers.